Hello, and thank you for viewing this presentation on this new and important college patient safety initiative. Information in this video has been presented at the Pharmacists Manitoba Conference in September and the Pharmacy Technician Conference in November 2020. We thought it would be beneficial for pharmacy professionals to access this presentation on the college website. Through professional development events and college publications, many of you will have heard of the College Safety IQ pilot program and the work that the college and members have undertaken. In line with the college mandate to protect the health and safety of the public, Safety IQ will become mandatory for all community pharmacies June 1st, 2021. These are the learning objectives we will cover. Describe the concept of continuous quality improvement within the healthcare field and pharmacy. Outline the elements and requirements of the college's Continuous Quality Improvement Program, Safety IQ. Understand the implementation steps pharmacies will need to undertake for the launch of Safety IQ in 2021. Understand the role of the college, pharmacy managers, and pharmacy staff all have in Safety IQ. And lastly, identify strategies to prepare for future implementation of Safety IQ within your pharmacy, both from a pharmacy manager and a pharmacy team perspective. Firstly, what is Continuous Quality Improvement, or CQI? Basically, it is a process of continuously looking at how you and the pharmacy operates and looking for ways to improve the safety of your practice as well as your colleagues. It is a process of continuously reviewing, making changes, and evaluating those changes to see if they are implemented and effective. CQI programs go beyond reporting. They help to establish a culture of safety where open discussion of incidents and analysis takes place to make changes in practice to prevent future errors. It is about being proactive and not simply reactive to incidents to improve safety. We cannot eliminate all the risk within pharmacy practice, but we can strive to make the system safer and reduce the risk. What is Safety IQ? Safety IQ is a continuous quality improvement program for community pharmacies. It is similar to CQI programs implemented in several provinces in the past few years. The objective of Safety IQ is for pharmacies to not only report and document incidents as required by the college, or perhaps for liability purposes, but to analyze, to make improvements, and then share their learnings with others. It also has pharmacies moving from reviewing incidents from a person-based approach to a systems approach. We try to determine how the error happened and what we can do to prevent it from happening again, rather than focusing on the staff involved. As humans, we make mistakes. However, we can look at the work environment to build a better system that is more resistant to human error. Safety IQ also focuses on pharmacies being proactive and looking for gaps and making improvements before an incident happens. Why is the college embarking on this initiative? The College Complaints Committee often sees issues related to pharmacies not handling medication incidents in a proper manner. Patients essentially expect pharmacies to acknowledge the error, apologize for the error, and also for the pharmacy to actively look for solutions to prevent recurrence for another individual. Fostering a culture of safety where pharmacy staff openly communicate about incidents and near misses allow us to move from a blame and shame environment to one that looks at ways to improve pharmacy systems and procedures. Sharing learnings among pharmacy professionals and pharmacies can improve safety beyond your individual pharmacy. This enables pharmacies to be proactive about pharmacy safety. Ultimately, the objective is to continuously improve the quality of care and make pharmacy practice even safer for our patients. This is a photo of Andrew Sheldrick and his mom, Melissa. Andrew died in March 2016 as a result of a medication error. Andrew mistakenly received a compounded preparation containing baclofen rather than tryptophan, as the pharmacy selected the inappropriate compound from the shelf. Andrew's mother, Melissa, has been calling for a national medication incident and learning program since her son's death. Melissa spoke with members of the Safety IQ pilot pharmacies at the first training session and has spoken to health ministers across the country and also internationally, sharing her family's experience and the need for shared learning from medication incidents. Today, there is a movement across Canada to decrease the number of medication incidents by expanding reporting and learning from medication incidents and patient safety events beyond the hospital setting to community pharmacy practice. Several provinces have implemented CQI programs, and others are in the process of research and development. The Safety IQ pilot was based on programs in Nova Scotia and Saskatchewan. In the hospital setting, critical incident reporting and analysis is already happening, and research is being done to look at possibly implementing reporting and learning from patient safety events and community practice for other healthcare professions. The Safety IQ pilot included 20 volunteer community pharmacies from rural and urban areas and from independent and corporate pharmacy. With the pilot, each community pharmacy followed standardized program requirements. The pilot objective was to determine if this was feasible and also to determine what factors hindered or encouraged reporting. A CQI researcher from St. Francis Xavier University solicited feedback from the pilot pharmacy staff and provided the college with an assessment of the pilot along with recommendations. Council approved moving forward with Safety IQ for all community pharmacies on June 1st, 2021. To help develop and in the future assess the Safety IQ program, Council established the Safety IQ Advisory Committee. It consists of members from the pilot pharmacies, the public, university and pharmacy technician colleges, and pharmacy staff. They reviewed feedback from the Safety IQ pilot pharmacies and the independent assessment report to the pilot in order to make recommendations and changes for the provincial program. The committee felt that shared learning within the pharmacy was an important goal, but also that there should be learning between pharmacies rather than each learning as silos. Therefore, individual pharmacy data will be exported to a national incident data repository. Many pilot pharmacies had an existing CQI reporting program, which led to dual reporting within the pilot. Staff would document the incident in the Safety IQ platform, as well as their own internal program. Dual reporting is a time barrier well documented in other provincial CQI programs. Therefore, rather than mandate one reporting program, pharmacies will be allowed to subscribe to a reporting platform. The committee recommended a short list of criteria for reporting programs to ensure the goals of Safety IQ are met. Also, the committee reviewed and updated the Medication Incidents and Discrepancy Practice Direction. Safety IQ includes looking at past harms, but also proactively reviewing current processes to determine gaps to focus efforts, to make changes to prevent future incidents. Firstly, pharmacy staff document incident and near-miss events in a reporting program of the pharmacy's choice that meets the criteria set by Council. The de-identified data is then exported to the National Incident Data Repository housed by ISMP Canada. De-identified, meaning no information related to the patient or the pharmacy staff is sent to the NIDR. The proactive component is the completion of a safety self-assessment within the first year of Safety IQ or pharmacy opening, and then within every 3 years thereafter. Understanding that some of these terms are new to many of us, I will provide more information on the NIDR, reporting platforms, and the safety self-assessment in the next slides. In reviewing incidents and the safety self-assessment, pharmacies make plans to improve procedures or systems to prevent future incidents. It is important to monitor and evaluate the effectiveness of these changes. Open communication and shared learning is key, and at least one staff meeting must be held annually to discuss incidents, near misses, and practice changes implemented. Informal huddles when incidents occur are also strongly encouraged for timely communication and discussion. With Safety IQ, many terms may be new to most of us, and a review of them will help to understand their role and importance. We will review the following: near-miss events, National Incident Data Repository, reporting platform and criteria, and safety self-assessment. This is a quote from Don Berwick, who wrote, "To err is human, building a safer health system. A near-miss event is an error that could have resulted in inappropriate medication use or patient harm, but was discovered by pharmacy staff prior to reaching the patient. Pharmacy professionals are very good at intercepting errors before the prescription leaves the pharmacy." Reviewing near misses provides an opportunity to consider possible gaps in the existing system or procedures that could put patients at risk. Not reviewing them is a missed opportunity to learn from today to prevent tomorrow's medication incident. Reports from pilots and other provinces show a higher number of near-miss reports compared to actual incidents. This demonstrates that staff see the learning opportunities of near misses. Not all near misses will be valuable from a learning perspective, such as the wrong doctor on a label or missing third-party information. Therefore, not all near misses need to be reported. With a near miss, pharmacy staff should consider if the patient may have been harmed if it had reached the patient. Does the same near miss happen repeatedly? Then perhaps there is a gap in the process or system that should be addressed. Do you think your colleagues could learn from this near miss? Pharmacy managers and staff should discuss and determine near misses to report. Using your professional judgment is also valuable. The goal of Safety IQ is to share learnings among pharmacies and pharmacy professionals. There currently exists a pan-Canadian organization designed to reduce and prevent medication incidents in Canada, the Canadian Medication Incident Reporting and Prevention System, also known as CMIRPS. Some of its partners are familiar to us: Health Canada, ISMP Canada, the Canadian Patient Safety Institute, and the Canadian Institute for Health Information, also known as CIHI. Two of these organizations collect incident data, CIHI and ISMP Canada. The NIDR for community pharmacy is hosted by ISMP Canada. Incident data from CIHI and the NIDR is analyzed by ISMP Canada, and recommendations are developed and shared across the country with all healthcare professionals, and also with federal and provincial governments. An incident reporting platform is a system or program that pharmacy teams use to record data on medication incidents and near misses. The reporting platform or program will then send de-identified data information to the NIDR to be combined with other provincial and national data. The College Council has set a short list of criteria around reporting, providing data summary reports back to pharmacies, and training requirements to ensure that pharmacies have the necessary CQI tools. The pharmacy manager is responsible for choosing or subscribing to a platform or program. A list of the criteria has been sent to all pharmacy managers, district managers, and reporting platforms that are currently used in Manitoba. The criteria is also available on the college website. The Safety Self-Assessment is a tool for pharmacy staff to examine various areas within the prescription process, to identify gaps in pharmacy practice that could put patients at risk. Some examples include documentation of allergies and other medical conditions, use of 2 patient identifiers at drop-off and pickup, or whether the drug container is opened in front of the patient during patient education and counseling. You consider what are we doing now and ask, are we doing it consistently, and how can we do it better? It helps pharmacy teams determine areas of strength and focus on specific areas for improvement. The safety self-assessment must be completed within the first year of Safety IQ implementation or new pharmacy opening, and at least every 3 years thereafter. 2 current reporting platforms have a safety self-assessment available, and others may be in development. Safety IQ includes 4 elements that create the Safety IQ cycle: report, analyze, share, and document. Each element plays an important role in continuous quality improvement and the ultimate goal of preventing medication incidents in your pharmacy. The first element of the Safety IQ cycle is report. Pharmacy staff report incidents and near misses within their reporting platform or program, and the de-identified data is then exported to the NIDR. Reporting of medication incidents and near miss events is the foundational element of the Safety IQ cycle and sets the stage for quality analysis and shared learning. Analyze is the second element. Teams review incidents and near misses to identify contributing factors and develop and implement changes in processes or systems. They conduct a safety self-assessment to review current practices, identify gaps, and make changes to close those safety gaps. Analysis is the backbone of patient safety improvement planning and shared learning. The third element is share. Staff communicates openly about incidents and near misses as they occur to discuss and learn, as well as have an annual meeting to review improvement plans and incident trends within the pharmacy. Staff share incident analysis done nationally to look at trends and patterns and provide recommendations to all pharmacy professionals. For example, ISMP safety bulletins. Open discussion of medication incidents and near-miss events and improvement plans ensure that your team develops a strong culture focused on patient safety. And the last element is document. For successful CQI, documentation is imperative to evaluate and monitor the effectiveness of action plans over time. Medication incidents, CQI improvement plans, and formal CQI meetings are all documented. ISMP Canada reviews incident data reports from across the country to look for trends and patterns and provide recommendations to all pharmacy professionals as well as Health Canada. Here are examples of learnings shared from ISMP from collected data in the NADR. Smart medication safety agendas are available on the college website under Safety IQ in the resource library. This type of information can be a starting point for staff discussions on medication safety, even if a similar event has not occurred at your pharmacy. The pharmacy manager and staff, as well as the college, each have a role to play within Safety IQ. The pharmacy manager is responsible to ensure staff understand the procedures on how to properly handle a medication incident so patients are the focus. All staff should be trained on the pharmacy's incident platform or program and should be able to enter incidents and near misses. Often, more than one individual may have information to contribute. The reporting platforms are responsible for providing training modules and ongoing support to the pharmacy. Managers can appoint a CQI coordinator other than themselves if a staff member is committed and knowledgeable. It is important that managers foster a culture of safety among all staff to encourage open discussions of incidents, near misses, and the development of improvements. Each pharmacy is encouraged to appoint a CQI coordinator to lead the implementation and ongoing practice of Safety IQ at the pharmacy. In Manitoba, there are a variety of pharmacy environments. While in some cases the CQI coordinator may be the pharmacy manager, it is not necessary that this be the case. Anyone who is competent and confident in their understanding of Safety IQ elements and processes may be the CQI coordinator, including a pharmacist or a pharmacy technician. The coordinator helps in many aspects of Safety IQ, such as to ensure staff are trained on the use of the incident reporting program, ensure incidents and near misses are consistently reported and discussed, foster communication on incidents and safety concerns, lead CQI meetings or informal huddles, conduct the safety self-assessment along with other pharmacy staff, and finally educate staff relating to safe medication practices and other safety issues. All pharmacy staff should be knowledgeable about the pharmacy's procedures in the event of a medication incident, to ensure the event is handled in a professional and thoughtful manner. What steps need to be taken and who needs to be contacted? Patients' safety needs to be our first priority. When an error occurs, patients want three things: acknowledgement and empathy for the distress, a sincere apology, and also they want to know that the pharmacy will review the incident and implement changes to prevent the same error occurring to another individual. Pharmacy staff must understand the reporting tool that the pharmacy uses and be aware of procedures for medication incident and near-miss event reporting to comply with Safety IQ. Managers, pharmacists, pharmacy technicians, and pharmacy assistants all have a different role in the pharmacy, and therefore a different perspective to note potential safety gaps and concerns. Everyone should play an active role in reporting workflow issues and in identifying potential safety issues and solutions. Safety IQ is not a punitive program, but rather a program to help pharmacies improve safety and develop a culture where patient and medication safety are the central focus for all pharmacy staff. The college does not have access to individual incident reports sent to the NIDR. By reviewing de-identified provincial incident data for trends, the college can look to develop tools and resources to share with all members to enhance patient safety. The college will develop resources and tools to educate pharmacy professionals on Safety IQ and over time assess the criteria for reporting platforms. College field operations staff during pharmacy visits and/or inspections will provide support and also assess how pharmacies utilize and engage with Safety IQ. Feedback from pharmacy visits can help inform future improvements to the program. June 1st, 2021 will arrive before we know it, so let's look at how pharmacies can prepare for mandatory Safety IQ over the next several months. The first step is to be informed and educate yourself on all things related to Safety IQ. The college has resources such as the Safety IQ Quick Fact Sheet and also the Frequently Asked Question Information Sheet. Review the updated practice direction, which will also come into effect June 1st, 2021. It follows closely the Safety IQ cycle and has a section outlining proper disclosure of medication incidents to patients. This is a lot of information to digest. So over the next several months, the college will be reviewing and expanding on information within this presentation in all its publications, the newsletter, and the Friday Fives. Please read these bulletins to stay informed. On the new college website, you can access the Safety IQ webpage on the college homepage for all Safety IQ information. You can also find Safety IQ resources in the resource library under Safety IQ. I encourage you to visit and explore the new website. All pharmacy staff should be engaged in the process. It requires a team effort, and everyone can contribute to safety. The Safety IQ Implementation Guide and the Safety IQ Implementation Checklist outlines the steps pharmacy managers should take to have their pharmacy and team ready for June 1st, 2021. Pharmacy managers will have to contact the NIDR to start the process to allow for sharing of incident and near-miss data with the NIDR. The resource, 4 Steps to Submit Data to the NIDR, is useful to guide managers through the process. Review platform criteria. Do you currently use an online CQI program? Does it satisfy the college criteria? If not, then you can seek to subscribe to a reporting platform or program that fits the criteria. There are several currently used within Manitoba. The reporting platform will work with the NIDR to facilitate export of data from the individual pharmacy to the NIDR. This work may take time, so we encourage pharmacy managers to consider the reporting program they wish to use sooner rather than later. Each platform provider will have available online modules for pharmacy staff to train on how to use the reporting program and its tools. It is important that all staff are educated and aware of the process. All should have a part to play in improving the safety of pharmacy practice for patients. Pharmacy staff should discuss prior to June 1st, 2021, processes for reporting during regular pharmacy workloads and days when it's busier than usual. Who will be reporting? When will it be done? And how? As your pharmacy comes across near misses during the next months, start the discussion over which would be beneficial to report. This way, the team will be prepared when Safety IQ is mandatory. The college wants to support pharmacies to ensure the implementation process can be a smooth transition. Resources and information will be available on the Safety IQ page and in publications. The college will communicate directly with pharmacy managers on a regular basis during this phase. College staff will provide support and education during pharmacy inspections and openings. The college also has a specific Safety IQ email address to answer questions in a timely manner. Please feel free to send questions and we will be happy to provide any assistance. This slide has examples of some Safety IQ resources available. Also, you can access on the college website 2 previously recorded PD programs, Culture Shift 101, Safety and Just Culture in Community Pharmacy, and also A Safer Future, Preparing Your Pharmacy for Safety IQ. Pharmacy is busier than ever. However, that also means the potential risk to patients may be higher. Safety IQ and the practice direction have been developed to help pharmacy professionals and pharmacies learn from each other to maintain and improve the standard of care and safety for patients. If you have any questions about Safety IQ, please contact the college at safetyiq@cphm.ca. Thank you very much for viewing this presentation.